A very good morning to all of you. I am Dr. Naveen Kumar Devangan, Professor in the Department of Electronics and Telecommunication Engineering, Bhilai Institute of Technology, Durg. It is a great pleasure to be here today with you all and talk about the exciting world of biomedical instrumentation and sensors in the fascinating realm of patient monitoring and diagnostic system. First of all, we will start with monitoring system concepts. Here we will see what is patient monitoring, why it is needed, and what parameters of a patient should be monitored. Then we will see cardiac monitor, which is nothing but an instrument to monitor heart rate and ECG waveform produced by the heart. Then we will see other parameters which are important in patient monitoring like blood pressure, pulse waveform and pressure, oxygen saturation level, respiration rate, etc. Then we will see concepts of bedside patient monitoring systems. There we will also see the block diagram of the bedside patient monitor. Then I will talk about other instruments for monitoring patients. We will also talk about concepts of central monitoring. We will also see organization of the hospital for patient care monitoring in very brief. We will see various diagnostic techniques and equipments commonly used to diagnose various diseases. In the last, we will see future trends in patient monitoring system. Now we are going to see monitoring system concepts for a quantitative evaluation of the patient's main physiological parameters during critical phases of their biological functioning. Patient monitoring is essential. Knowing their actual value or pattern of change is crucial for diagnostic and research purposes. Patient monitoring systems automatically measure the patient's significant physiological parameters either continuously or at predetermined intervals. Critically ill patients recovering from surgery or a heart attack or other major illnesses are sometimes kept in specialized units, generally referred to as intensive care units ICU, where electronic instruments continuously monitor their vital parameters. The long-term objective of patient monitoring is generally to decrease mortality and morbidity by improving patient care through the organization and display of the information in a meaningful form, correlating several parameters to demonstrate clinical issues clearly. Third, processing the data to set alarms on the development of abnormal conditions. Next, providing therapy related information based on automated data and ensuring better care with fewer staff members. During surgery, the patient is deprived of various natural defense mechanisms that could otherwise restore physical anomalies or alarm others. Indications or alarms that the patient cannot supply themselves can be displayed via patient monitoring system. Also, it is common for surgical operations to take several hours in special circumstances. It is difficult and challenging for the anesthesiologist and the surgeon to manage anesthesia, surgery, fluid therapy and many other things that are necessary under such circumstances, while simultaneously keeping a tight eye on the patient's vital signs throughout these operative surgical operations. Additionally, it is important to keep an eye on any connected life supported devices like a ventilator or heart-lung machine to ensure that it is functioning properly. Thus, a patient monitoring system provides the surgeon and anesthesiologist more information about the patient's state and the condition. Thanks to patient monitoring equipment, because now it is possible to spot problems before they become serious, and fast corrective action can be taken well in time, thereby reducing the risk associated with surgery. Selecting the appropriate parameters with a high information content is important while monitoring patients, but it is generally agreed that regular monitoring of the following biological parameters is necessary. First one is electrocardiogram, in short we call ECG. Second, heart rate, which can be instantaneous or average. Third one is pulse rate. Fourth one, oxygen saturation level, we call it SpO2. Next one, blood pressure, it can be indirect arterial blood pressure or direct arterial blood pressure or venous blood pressure. Next one is body temperature, and next one is respiratory rate. In addition to these primary parameters, electroencephalogram, EEG, and respiratory parameters like volume, carbon dioxide also become part of monitoring in special cases. In addition to this equipment, such as defibrillators and cardiac pacemakers are routinely needed in the intensive care wards. Usually, monitoring takes place at the central station, at the bedside, and at the bedside with a central display. The choice between them is made based on medical needs, space restrictions, and cost considerations. Coming to cardiac monitor, that is ECG and heart rate meter. The two most important physiological indicators monitored in the critical care unit are the heart rate and the morphology or shape of the electrical waveform ECG produced by the heart. This is done to look for heart rate variations or arrhythmias that might indicate a dangerous or a serious condition. A cardiac monitor is helpful for monitoring patients with heart issues in these circumstances. The specific sections of the hospital where they are frequently employed are called as cardiac care units CCU or coronary care units CCU. These instruments are called cardiac monitors or cardioscopes and comprises of pre-gelled disposable electrodes to pick up the ECG signal. Typically, the lead 2 configuration ML2 is used to monitor the ECG, though it can be recorded in other modes also. Amplifier for the amplification and cathode ray tube or LCD for displaying the ECG signal, which enable direct observation of the ECG waveform. A heart rate meter to indicate average heart rate with audible beep or flashing light or both with each beat. An alarm system to produce signal in the event of abnormalities occurring in the heart rate. The cardioscope is basically similar to the conventional oscilloscope used in electronic laboratories to display waveforms. However, they are different from the conventional instrument in two crucial aspects. These have a prolonged persistence screen and slower sweep speeds. The ECG signal is of low frequency and the sweep is kept slow because of this. Due to the slow sweep speed, a long persistence screen must be employed for the convenient viewing and reading of the waveform. Without a lengthy persistence screen, one can only observe a moving dot of light rather than a continuous trail. Small cardioscopes using 7 to 12 centimeter diameter cathode ray tubes are mounted on anesthesia trolleys. These are called anesthesia monitors. The anesthesiologist uses these monitors to continuously monitor the ECG of the anesthetized patients. Figure 1 shows a typical cardioscope. It can monitor ECG waveform and can measure heart rate. The alarm facility is also given there. Apart from ECG waveform and heart rate, other parameters are also monitored. These are usually blood pressure, pulse waveform and pulse rate, oxygen saturation level, PSO2, respiration rate and temperature. The second physiological signal parameters often of prime importance in an intensive care unit is blood pressure. Blood pressure can be monitored using the automatic cuff pump and Korotkoff microfoam based indirect method. Generally, oscillometric method is used by the manufacturer, where systolic pressure and diastolic pressure values can be monitored by the indirect method. For continuous measurement of blood pressure, direct method like percutaneous insertion or catheterization, that is vessel cut down methods are used. This method is seldom used when and is used when a special case arises. Coming to monitoring of pulse waveform and pulse rate. Each time the heart muscle contracts, blood is ejected from the ventricles and a pulse of pressure is transmitted through the circulatory system. The pulse pressure and waveform are indicators for blood pressure and flow. Instruments used to detect the arterial pulse and pulse pressure waveforms in the extremities are called plethysmographs. Most plethysmograph techniques respond to a change in the volume of blood as a measure of blood pressure. The method used for the detection of volume or pulse changes due to blood flow are electrical impedance changes, strain gauge or microphone, optical changes, that is photoelectric method. A pulse oximeter measures blood oxygen levels and pulse rate. A low level of oxygen saturation may occur if you have certain health conditions. So, pulse oximeter is used to measure pulse rate and oxygen saturation level in the blood. It is often desirable to monitor the patient's respiratory activity during intensive care. This may be accomplished with displacement method, thermistor method, impedance pneumography, CO2 method of respiration rate and measurement, apnea detectors. It is often desirable to monitor body temperature in intensive care subjects via a rectal or armpit thermistor probe. Next, going to explain most important topic now, bedside patient monitoring systems. There are variety of configurations of bedside monitors offered by different manufacturers. They all have the ability to continuously monitor and display the ECG waveform and heart rate without fading, even though they all are designed to monitor different parameters. Some instruments can also monitor heart rate, blood pressure, temperature and breathing rate. A typical example of a microprocessor based bedside patient monitoring instrument is shown in figure 3. Monitors are made up of modular components and can measure the following parameters: ECG and respiration, blood pressure, non-invasive NIBP, measuring electronics, pump and tubing, blood pressure invasive, temperature measurement, pulse probe and SpO2 by pulse oximetry. Monitors consist of the following modular parts: microprocessor board including analog signal multiplexer, A to D converter and real time clock, video control board to convert the CPU commands into video signal, video display module, transformer and power supply board to generate necessary voltages, motherboard including signal buses and analog input signal buttons, keyboard. The whole system works under the control of multiple processors. Thus, the important features in today's patient monitors are mobility, ease of use and effortless patient data transfer. Mobility includes portability and the capacity to connect to other medical devices such as anesthetic machines or defibrillators. Ease of use can be achieved with touch screen displays and multi-level menu driven profiles that can be configured for the environment as well as the patient's vital statistics. Data transfer across everything from wireless to RS-232 needs to be possible. Figure 4 shows cardiac multi-para patient monitor manufactured by Standard Healthcare and is available on Amazon. This equipment can monitor 5 physiological parameters of a patient: ECG waveform, heart rate, blood pressure, systolic versus diastolic pressure, SpO2 and temperature of the body. This product comes with accessories. You can see different accessories provided by the manufacturer with this monitor. You can see 5 ECG leads to peak ECG of a patient in 12 different modes. SpO2 sensor probe to measure oxygen saturation level in the blood. You can also see temperature probe to monitor patient's body temperature. NIBP cable to monitor non-invasive blood pressure. Power cable so that the equipment can be connected to power source. Disposable electrodes to peak ECG and also provided with earth cable. Here in this slide 19, specifications of Standard Healthcare cardiac multi-para patient monitor are shown. Another patient monitor is shown in the figure 5. Product is of Dr. Diaz and can monitor up to 7 physiological parameters. Here in this slide 21, specifications of Dr. Diaz 7-para patient monitor is shown. Now coming to other instruments for monitoring patients other than bedside. There are several other special medical instruments in use which are other than bedside of the patient. The important ones are: first, surgical monitoring system. These are large multi-channel oscilloscopes. Such equipments have plug-in signal conditioning module that provide versatility and choice of measurement of parameters. These signal conditioners unit include a universal unit for biological signals, an ECG unit, an EEG unit, a biotachometer, a transducer unit, an integrator, differentiator, and an impedance unit. Second one is arterial diagnostic unit, in short we call ADU. It provides automated pressure cuff inflation for rapidly determining segmental pressures and post exercise pressure trends in non-invasive peripheral arterial evolutions. The strip chart is used for recording Doppler flow pulse waveforms, ECG traces, and other physiological waveforms. It has heated stylus strip chart recorder, a bidirectional Doppler flow meter with external loudspeaker and headphones, an ECG telemetry transmitter, a non-fed 2-channel oscilloscope. Third, catheterization lab, in short we call it cath lab. It is a lab where cardiologists perform diagnostic catheterization. For a patient having blockage in one of the coronary arteries must be brought into cath lab. Catheterization techniques introduce a catheter into the heart, and through this catheter radiopaque dye is injected. Catheterization is a dangerous procedure, therefore patient must be monitored continuously. Cath lab is capable of monitoring cardiovascular pressures, cardiac output, and an ECG. During the process, patient's name, physiological data in digital form, blood pressure, and ECG waveforms are also displayed on CRT. Operator can monitor or call any data on a screen for instant display. Now coming to the concepts of central station monitoring. With central monitoring, a central station displays and records the measured values. Typically, data from bedside monitors is displayed at a central station along with alarms and other warnings. The central station monitoring apparatus may use a multi-microprocessor architecture to display a configurable mix of smooth waveforms, alphanumerics, and graphics on a single display. This provides all the information and data in one place and benefits the hospital staff in several ways. First, it provides both visual and audible alarms if present vital sign limits are exceeded. Secondly, it displays data on the patient's vital signs. By monitoring this data, the attending personnel can identify problems before they become serious. Vital sign trend graphs are useful in directing a patient's treatment. Thirdly, it provides a recording of the ECG and other parameters, especially of the few seconds just before an alarm, which shows what kind of irregularity led to the alarm. Central stations are primarily designed for coronary care patients to display ECG waveforms and heart rate information, say for 8 patients. A real-time ECG waveform and alarm information are shown on the display in figure 6 for 4 seconds. For observation and or documentation, a long trend for either 9 or 24 hour or short trend 90 minute may be selected for the display. The information for the central monitor is collected from the bedside. Each bedside cable has up to 15 analog signals that reflect physiological data such as various blood pressures, ECGs, heart rates, respiration, end-tidal CO2 and temperatures. Using the same cable, status information including alarm signal is also transmitted. The 80 or so incoming physiological values are then sampled and digitized at appropriate rates by an analog to digital converter. ECG waveforms are sampled every 2 milliseconds to maintain the 0 to 100 Hz bandwidth. Slowly varying variables such as temperatures are sampled every 4 seconds. Figure 6 shows a typical display on the patient information center at a central station. The display depicts information on the heart rate, alarm limits, display of ECG waveforms from 4 to 8 patients. There are two parts in the display section: a raster type display for waveforms and a traditional 300 into 260 picture element bitmap for alphanumerics and graphics. A 1200 line vertical raster is utilized to give the waveform a smooth appearance. The display subsection also manages a 16K word memory which is used as temporary storage for waveform and hard copy data. ECG waveform data for each patient is continually stored temporarily to provide a delayed, typically of 8-second waveform output for recording. The delay is used to take a picture of any ECG irregularity that triggers an alarm. The display processor keeps it until a recorder becomes available if the recorder happens to be busy. For 24 hours, the trend's memory can save patient data. It has a 6K word RAM that can be attached to a battery backup power supply because it uses very little power when it is in standby mode. Thus, following a power outage, the patient data is kept for at least 24 hours. Typically, alarm signals are audible and are visuals. By adjusting pitch, amplitude, duration and sequencing of the tones, audible alerts can be identified. By varying the color of the display on the monitor screen, visual alerts can be indicated. Alarm conditions can also be captured in hard copy documentation via automatic generation of a recording at the time of the event. Traditional limit alarms need to be set up by the nursing staff. One monitor can now be used to monitor a large number of patients because to the growing use of workstations in central monitoring setups. Patient and equipment status are indicated by simple color graphic symbols. Flexible systems have been made possible by the simplicity with which the displays can be networked using the existing computer network wiring. The central station can observe and control the patient's bedside monitors. All waveforms and numbers can be automatically recorded, saved and kept for up to 3 days after the patient is discharged because the workstation's huge storage capacity. Figure 7 shows the view of a modern central patient monitoring station. Figure 7 is showing central patient monitoring, which is making use of several monitors at a central station. Coming to the organization of the hospital for patient care monitoring. The technical personnel must be familiar with the hospital organization, such as which diagnostic equipments are available in what part of the hospital. Generally, equipments are divided on the following lines. First one is surgical equipments. These are placed in the operating room where surgery is actually performed. Second, non-surgical equipments. The monitoring equipments available in the operation room are heart rate meter, venous and arterial blood pressures, ECG, EEG, various respiratory therapy devices. It may have emergency equipments like defibrillator and pacemakers and stimulation equipments, etc. The intensive care unit, which is generally post-surgical follow-up, contains monitoring equipments, nurse central control units to monitor patient's condition continuously. Heart attack patients are placed in coronary care unit and sometimes called cardiac care unit. The monitoring units may have blood pressure, heart rate and ECG measurement equipments. After some recovery, CCU patient may move to intermediate coronary care unit. This unit may have equipments like telemetry equipments to monitor patients from ambulance. If the patient has heart attack at home, mobile emergency care unit comes into service. This may have cardiopulmonary resuscitation technique experts with equipments and medication similar to the ones used in the intensive care units of the hospitals. Now coming to various diagnostic techniques. Diagnostic techniques involve measurements to help in detection of some malfunction of the system of the body. It can be divided into two broad categories: non-invasive diagnostic technique and invasive diagnostic technique. Non-invasive techniques don't involve getting inside the body physically or invading it. The non-invasive diagnostic techniques are not traumatic for the patient and don't have any detrimental side effects on the patient. The non-invasive techniques are very sophisticated, which offer accurate results without invasion of the body. The diagnostic equipments and their underlying principles may be based on or related with one of the following. First, ultrasonic diagnostic based on ultrasound. Second, X-ray and radioisotope instrumentation based on X-ray radiograph. CT imaging system based on X-ray and the use of computers. Fourth one, emission computerized tomography based on radioisotopes of certain elements. Fifth one, MRI imaging systems and techniques based on hydrogen nucleus properties in the magnetic field. Coming to first, ultrasonic diagnostic. Ultrasound imaging systems are comprised of the pulse ultrasound or pulse Doppler mode. The ultrasound diagnostic techniques are used in cardiology, abdominal imaging, brain studies, eye analysis, obstetrics and gynecology. Coming to second, X-ray instrumentation. X-rays can penetrate opaque objects and provide an image of their inner structures. These images are used for medical diagnosis. X-rays are also used for therapeutic purposes. This is the domain of the medical specialty known as radiology. Now coming to third, radioisotope instrumentation. Radioisotope techniques are based on counting the number of nuclear disintegrations that occur in a radioactive sample during a certain time interval. Nuclear radiation detectors used for medical applications utilize the light flashes caused by radiation in a suitable medium. Now coming to the fourth technique, CAT scan system. Computerized axial tomography combines X-ray imaging with computer techniques. CT permits visualization of internal organs with a greater clarity. Now fifth one, emission computerized tomography. Radioactive isotopes of certain elements can be used to trace the metabolism, pathways and concentration of the body parts. ECT can provide detailed 3D distribution map of an isotope which is injected into the body and allowed to distribute itself. Now sixth one, MRI magnetic resonance imaging is based on the nuclear properties of hydrogen atoms in the body. The MRI images are accurate for visualization of tumors, inflammatory and vascular abnormalities. All these diagnostic systems we have already seen in my various lectures. Now coming to future trends in patient monitoring system. In future, patient monitoring will also involve the use of blood gas analyzer, drug dosage calculator, drug management system, RFID in patient monitoring system, real-time patient location system, wearable patient monitoring system, telemetry or telemedicine concept where from distance when patient is not in the hospital their important physiological parameters can be measured and transmitted to the central station of the hospitals. Figure 8 illustrates use of wearable patient monitoring system. Here you can see how a person's physiological parameters at a distance are transmitted to home, to clinician and to the hospital by the use of cell phone using internet. So with this I complete my today's lecture on patient monitoring and diagnostic techniques. If you need any further information or clarification, feel free to contact me through my email naveen.devangan@gmail.com bitdurg.ac.in. Thank you all.